Yes, sir.
Right. So this is the first definition of Apache score. Initially, it was acute physiology and chronic health care. Now it is changed to acute physiology, age, and chronic health care. So that and has now become age. So Apache score is a best known and most widely used score with good calibration and discrimination. It was first described in 1981 and consisted of two sections: physiological score and pre-admission evaluation to discuss about the chronic health status. So severity of health score system helps to assess the outcome of groups of critically ill patients who are admitted to ICU. So it assesses the outcome at the time of admission itself. So scoring system consists of two parts: severity score, which is a number generally higher than the number more severe the condition, and the calculated probability of mortality. So both can be uh, assessed by the scoring system. And as he rightly said, this is done only once during admission. First day scoring system is Apache. After that, to assess whether the patient is improving or deteriorating, you have to use the repetitive scoring system like OSF, TOFA, etc. But Apache is only the on entry or on admission scoring system, first day scoring system. And sorry. Uh, so the original score had 34 physiological measures. Acute physiology itself, they were measuring 34 things, which was not some of all acute physiology scores, what of the initial first 24 hours. And chronic health care was classified into A, excellent health arbitrarily, and D, severe organic dysfunctions. So they were not mentioning what exactly was the pathology in the chronic health. So that was the first original Apache. Then Apache 2 came in 1985. It included only 12 variables. And the Apache 2 scoring system measured during the first 24 hours of ICU admission and had a maximum score of 71. And the score 25 represents a predicted mortality of 50%. And if the score becomes 35, the mortality is as high as 80%. So based on this number, you can decide whether the patient is going to survive or not, and you can give an idea to the relatives whether it is worthwhile keeping the patient in ICU and spending, or they can take a decision on that. And this is a sum of three things: acute physiology score, age, and chronic health score. That is the Apache 2, which is there. And these are the total points that are given. And then came Apache 3 in 1991, developed the objective of improved statistical power. So using more statistics, they were able to improve on that. But as he rightly said, it became um, uh, they had a ownership over that. So you cannot, not everybody can use that. And if you want to use that, you have to pay and get that calculator to assess the values that you can get. And these are the things that he mentioned, the 12 variables which are classified according to her. And in that, some people include the GCS also. Okay? So if you can use that. Otherwise, you can use all the other parameters. And this is the classification and how the grading is done. Based on the zero, you have the positive values as well as the positive values for the lower side also. So high abnormal range and low abnormal range. And these are all the values that you try to get that. And based on the history of organ deficiency, chronic health, initially it was non-operative patients, and then emergency post-operative patients and elective post-operative patients. So these were the three categories for chronic health points. But later on, organ insufficiency included immunocompromised state, hepatic insufficiency, cardiovascular insufficiency, respiratory, all systems were included later on. Okay, so initially it was these 3 points that are there. But now with all these things, you have to include them also in correct calculating the Apache score system. And Apache 3 scoring system is classified into based on acid-base disturbance and age scoring, and GCS scoring, especially if the patient is coming in a confused or comatose or a drowsy state, then GCS is also included in assessing the mortality. Not only in metabolic coma conditions, as well as head injury and trauma conditions also will include this. So GCS is also another thing that is taken into this. And Apache 3, the chronic health condition, you can see the comorbidities have changed from the earlier what we saw in that Apache 2. Now AIDS is included, hepatic failure, lymphoma, metastatic cancer, multiple myeloma, immunosuppression, cirrhosis, all these things are included as comorbidities for assessing the chronic health condition. And Apache 4 score system has as many as 142 variables, but is web-based and can be done and developed and validated in ICUs, which are not used for this. So these are the things that can write about Apache score. But you actually rightly said you have to give more importance to Apache 2, which is still commonly used. And the most important point you have to remember is it is a on admission scoring system to decide about the mortality and morbidity and the possibility of the recovery, so that we can take the correct decision to see whether you can spend all the resources useful for the patient or whether it can be avoided. Okay, that is the thing that is we are going to achieve with this. Okay, very good. For a new batch, I think we have done an excellent job. All of you have prepared all the answers very well. An excellent beginning, even though the start was delayed. Progress and finish was superb. Okay, so all of you did an excellent job. I hope you continue this in the future also.
Yes, sir.
So we'll come with more theory questions for you to answer and prepare next class. I'll send the questions to, I think Muthupriya is going to be the coordinator.
Yes, sir.
So I will send the questions to her and all of you can plan. I want all the exam going who are going to appear to participate, not to repeat like the last batch. Only 4 people were repeatedly presenting. So I don't want that to happen. I want all students to take part and prepare so that we can get the best out of